According to the NHS, acne is a very common skin condition that causes spots, oily skin, and sometimes skin that feels hot or painful to touch. It mainly appears on your face, back, and chest, and it affects the vast majority of people between about 11 and 30 at some point in their lives. It can also continue into adulthood, including well into your 30s and beyond. Acne forms when hormones tell the grease-producing glands in your skin to make more oil. The lining of the hair follicle thickens and blocks the pore, and a normally harmless skin bacterium becomes more active inside that blocked pore and causes inflammation. So yes, hormones are absolutely involved. During puberty, this hormone shift is normal, which is why so many teenagers get acne. But hormonal changes later in life, for example around your menstrual cycle, in pregnancy, with certain medications, or in conditions like polycystic ovary syndrome, can also trigger or worsen acne. Dermatology guidelines also highlight that medicines such as some steroids or lithium can worsen acne, which is another reason a proper medical review matters. There isn't a separate NHS diagnosis called hormonal acne, but many people notice clear patterns. You might see breakouts that flare in the week or so before your period, spots focused around the lower face, jawline, chin, neck or upper back, or deep painful bumps known as nodules or cysts, rather than just a few blackheads. Hormonal patterns can also show up alongside other signs of androgen activity, such as irregular or absent periods, unwanted facial or body hair, thinning hair on the scalp, or weight changes, especially around the middle. Those combined features can be a clue to something like PCOS, which is known to be associated with acne through higher androgen levels and insulin resistance. Dermatology-led guidance used by NICE emphasizes that in people with suspected PCOS and acne, standard acne treatments are still appropriate, and hormonal treatments can be added when needed based on the overall clinical picture. There are a few big myths that really need busting. The first myth is that you have acne because your skin is dirty. The NHS is very clear that acne is not caused by poor hygiene, and in fact, overwashing can make things worse by irritating the skin. The second myth is that it is all about sugar or dairy, and that you just need to change your diet. NICE guidance on acne says there isn't enough evidence to recommend specific diets as a treatment. A balanced diet is great for overall health, but food changes alone rarely fix moderate or severe acne. The third myth is that if it's hormonal, skincare can't help, and only supplements or detoxes will work. Evidence-based topical treatments that target oil, bacteria, and inflammation are actually the foundation of acne care, whether hormones are involved or not. High-quality dermatology research, summarized in NICE's acne guideline, shows that combinations of topical retinoids and benzoyl peroxide are among the most effective first-line treatments. Fancy hormone-balancing supplements often have weak or no evidence and can be expensive distractions. If your acne is mild, for example, mostly blackheads, whiteheads, and small red spots, NHS guidance says you can often start with self-care and pharmacy treatments. Gentle, consistent care makes a difference. Wash affected skin no more than twice a day using a gentle, non-alkaline cleanser and lukewarm water. Avoid harsh scrubs, pore-clearing tools, and frequent exfoliation because they irritate and can worsen inflammation. Choose non-comedogenic, oil-free makeup, moisturizers, and sun care, and remove makeup fully before bed. Don't squeeze or pick spots because that increases the risk of scarring and pigmentation. Regular exercise can help mood and self-esteem, and it's fine with acne as long as you shower afterwards because sweat can irritate the skin. From a pharmacy, you can ask about products containing benzoyl peroxide, over-the-counter topical retinoids or combination gels where available, and simple, fragrance-free emollients if your skin gets dry. Dermatology trials show that these treatments usually take at least 6 to 8 weeks before you see a clear change. That's frustrating, but it's normal. And stopping too early is one of the most common reasons treatments seem to fail. You should book a GP appointment if pharmacy treatments for several weeks haven't helped enough, if your acne is moderate or severe with many inflamed spots, nodules or cysts, or if you're getting painful breakouts on your chest or back. It's also important to see your GP if you're noticing possible hormonal features such as irregular periods, excess hair, scalp hair thinning or weight changes, or if acne is affecting your mental health through anxiety, low mood, avoiding social situations, or feeling ashamed of your skin. A GP can confirm it really is acne and not another skin condition. Check for underlying issues like PCOS or medication side effects. Prescribe stronger topical treatments such as combinations of retinoids and benzoyl peroxide or retinoids with antibiotics. Prescribe oral antibiotics short-term if you have moderate to severe acne, and discuss hormonal options if appropriate and safe for you. Dermatology-based NICE guidance also recommends referral to a consultant dermatologist-led team if acne is severe, not responding to 2 adequate treatment courses, causing scarring or causing significant psychological distress. For people who have acne plus features of androgen excess, hormonal treatments can be very effective parts of the plan. These may include combined oral contraceptive pills, which are known to improve acne over time by reducing the effect of androgens on the skin. NICE acne guidance, developed with dermatology experts, supports using a combined pill in preference to a progestogen-only pill if you're seeking contraception and also managing acne, provided there are no medical reasons you cannot take it. Another option is cociprindiol, which combines cyproterone with ethinyl estradiol. Dermatology-led guidance used by NICE suggests this may be used for severe acne linked to androgen activity when other treatments haven't worked, but it carries specific risk, including a higher risk of blood clots, and needs careful monitoring and time-limited use. In specialist dermatology settings, particularly if PCOS is confirmed, hormonal regimens are tailored based on your overall health, fertility plans, and risk profile. All of these are prescription only, have benefits and risks, and won't be right for everyone. They must be decided with your doctor, not bought online without proper supervision. Most acne is not an emergency, even when it feels overwhelming, but there are times when you need urgent or emergency care. If your skin suddenly becomes extremely painful with severe ulcerated acne, fever, or feeling very unwell, this could be a rare, severe form called acne fulminans, which needs same-day urgent assessment by dermatology through hospital care. You also need urgent help if you have thoughts of self-harm or suicide linked to your acne or your appearance. That is an emergency for your mental health, and you should contact your GP urgently, NHS 111, or emergency services if you're at immediate risk. You deserve support. Acne is a medical condition, not a personal failure. For people over 12 with severe acne at risk of scarring who haven't improved with standard treatments, Isotretinoin, often known by the old brand name Roaccutane, can be transformative. The NICE Acne Guideline, produced in partnership with dermatology experts and the British Association of Dermatologists and updated in line with MHRA's safety advice, has tightened measures around Isotretinoin, especially for under 18s and for people with a history of mental health difficulties or pregnancy risk. If isotretinoin is considered, it will be prescribed and monitored in specialist dermatology care. You'll have detailed discussions about benefits, risks, contraception, and mental health monitoring, and it is only used when adequate courses of other treatments, including oral antibiotics and topical therapy, have been tried first. For some people, this is life-changing medicine. For others, it's not needed. The key is an honest, supported conversation with your dermatology team. One thing that comes through strongly in dermatology-informed guidance is that acne at any severity can have a big impact on mental health. It's not just a few spots when you avoid eye contact, dates or photos, when you spend hours researching skincare and feel like nothing works, or when you feel angry at your own body, especially if you're also dealing with period problems or PCOS. If that resonates, you're not being dramatic. it's absolutely valid to ask for help both for your skin and your mental well-being. Your GP can also support you with referrals to mental health services if acne is contributing to depression, anxiety, body dysmorphic disorder, or self-harm thoughts. Dermatology services themselves are increasingly aware of the psychological weight of visible skin conditions and can factor this into decisions about treatment and referral. Let's bring this together into clear next steps. First, identify your pattern and notice where your acne is, how severe it feels, and whether it flares with your cycle or other hormonal changes. Second, optimize self-care and pharmacy options with gentle cleansing, non-comedogenic products, and appropriate pharmacy treatments such as benzoyl peroxide, and give them at least 6 to 8 weeks. Third, book a GP appointment if any of the checklist applies, and go in with notes on how long you've had acne, what you've tried, your cycle patterns, and any other symptoms like excess hair or mood changes. Fourth, ask about all suitable options, including topical retinoid benzoyl peroxide combinations, short-term oral antibiotics, and if appropriate, combined contraceptive pills or other hormonal approaches guided by dermatology-based recommendations. Finally, look after your mental health, and if acne is affecting your confidence, mood, or relationships, say that out loud in your appointment because it matters and it changes what should be offered. Your skin is not a moral report card. Hormonal acne is a medical condition with medical treatments, and you deserve proper, evidence-based care, not blame and not empty promises. If you're listening to this and thinking, this really sounds like me, my skin, my cycles, my weight, my energy, then understanding your hormones in more depth is the next smart step. PCOS, or Polycystic Ovary Syndrome, is one of the most common hormonal conditions affecting women, and it can play a big role in how your skin behaves. So, to help you go deeper without having to search for anything, we've made a full video on PCOS, what it is, how it affects your hormones, and how that can show up on your skin as acne. It should be on your screen now. Just tap it to keep going and learn how all of this fits together in your body.